Welcome back to the NCD Academy panel discussion series on COVID-19. It is my pleasure to lead this final series installment about building back better to put people first in the NCD response. On behalf of NCD Alliance, I hope you have found great value in other aspects of our COVID-19 programming on NCD Academy. The course, developed with our partners at the American College of Cardiology on recommended care for people diagnosed with COVID-19 or experiencing a chronic health condition during this time of crisis. However, it is vitally important, and we also need to keep in mind that COVID-19 is a public health challenge. The vast strides we have made in our clinical understanding of the virus will go waste without strategies that protect all vulnerable people and allow broad access to medical care. This is the goal with this series to parse out the implications of COVID-19 at health systems level and the unique challenges facing system in different regions at different levels of economic development. Today's panel focuses on an issue that has been acute for decades and has only become more dire during this pandemic. That is the prevalence of non-communicable diseases. The pandemic has underscored the need to act more importantly on non-communicable disease prevention and control. This pandemic is putting the long-standing lack of investment in NCD prevention and control in the spotlight and consequently the Build Back Better agenda for NCDs. It must be a central part of the global health conversations about resilience, recovery, and rebuilding for COVID-19. So, with today's panel, I would like to start first by introducing myself. I am Dr. Monica Arora, Executive Director of Hriday, an NGO based in New Delhi, India, that houses the Secretariat of the Healthy India Alliance. I am joined today by an esteemed group of experts from across Asia who are here with us to discuss challenge of building back better as it relates to our region of the globe. So I have now the privilege of introducing our panelists for today. We have Dr. Muralidharan Muneswamy. He is Medical Director, National Cancer Society of Malaysia, to focus on the importance of ensuring strong healthcare workforce and understanding of NCD interplays. Our second panelist today is Dr. Shamim Talukdar. Dr. Talukdar is Coordinator NCD's Forum Bangladesh and CEO of Eminence in Bangladesh. He will focus on the use of champions to raise the profile of NCDs and needs of people living with NCDs during COVID-19. Welcome, Dr. Muneswamy and Dr. Talukdar. We also have our third panelist for today, Mr. Ralph Emerson de Galicon. He's Project Manager, Healthy Philippines Alliance, to focus on legal and legislative efforts to integrate NCDs in the national COVID-19 response. And our last panelist for today is Nupur Lalvani. She is Founder Director of Blue Circle Diabetes Foundation and member of Healthy India Alliance. She will speak as an expert advocate on NCD service disruptions and engaging communities and people living with NCDs in efforts to build back better. So welcome all our panelists today. It's a very knowledgeable and an expert group that has been put together by NCD Alliance. And it's a privilege to be hearing the perspectives and views of our experts today. So I would like to start our discussion today. And these are organized in themes, but I will pose specific questions to our panelists. So I would like to start with Dr. Talukdar. So, Dr. Talukdar, welcome to the discussion today. And I would like to put my first question to you. How good a job would you say governments are doing at tracking the impact of COVID-19 on care of chronic diseases through data collection and other monitoring and evaluation efforts? Over to you, Dr. Talukdar.
Thank you, Monica, for a very important question related to the COVID-19, as well as to understand the extent of the problem in a country like Bangladesh and Southeast Asia and other countries too. Let me first share, the situation in Bangladesh. Like, if you look at that, our patient data management system, it is not up to the mark, and we don't have that type of structure at the government level as well as in the non-government private level to get the information related to the disease, especially non-communicable disease. In Bangladesh, government tried to establish different non-communicable disease registration system, but we are still at the beginning, part of this registration system. Then, when COVID comes in, 8th of March 2020 in Bangladesh, and now we have crossed more than 4 lakhs people are infected, and several thousand people also died. And unfortunately, we have lost lots of physicians for solidarity fund activities. We did an advocacy meeting with our government as well as the WHO, and we asked them that, do you have any data related to the non-communicable disease and COVID-19? And unfortunately, our government don't have any segregated data related to the non-communicable disease and COVID-19. We asked that, as a structure, government is supposed to give information related to the comorbidities of the infected people. But still, they are in a process. They could not give us any proper information related to the non-communicable and COVID-19. I had also asked the one representative of WHO that, do they have any information related to the non-communicable disease and COVID-19 data, and she said that she is not also aware about any segregated data related to the non-communicable disease. So my point why I discussed about these issues related to the government and WHO, my personal feeling is that it is a little bit policy issues, and WHO can play an important role to collect the national level non-communicable disease and COVID-19. As you know that in Bangladesh, when COVID-19 come up, then WHO provide very strong support to the government for management as well as treatment protocol development and capacity development of the healthcare professionals. So I think that this is also important to put the indicator like diabetes, hypertension, cancer, mental health related to others, comorbidities when patients are coming in the hospital. I'm still in dark as a advocacy person in Bangladesh. I'm engaged with the government, engaged with the other civil society members, but we don't have any data related to the non-communicable disease. Finally, if you look at that health service provided in Bangladesh, it is more than 60% services provided by the private sector. And private sectors are not aware about to provide any data to the government or any authority related to the non-communicable disease or other disease and what service they're providing. So I think that still, if I want to say that this is an opportunity, this COVID-19, to ensure generate data regularly and monitor the services and ensure the quality of healthcare services in Bangladesh, as well as this case may be important to share with other developing countries, especially in Southeast Asian countries or other in Africa and other countries to ensure generating the data related to the non-communicable disease. Thank you.
Thank you so much, Dr. Talukdar. Indeed, we all know how important monitoring and evaluation efforts are if we have to devise a response or counter strategy. We also know it's a missed opportunity if during the testing we can collect data on comorbidities, existing comorbidities, and if the information is not written up correctly, we would lose that data. So I would at this point like to invite Dr. Murali to also present his perspective on how good a job we think governments are doing on collecting data and monitoring around COVID-19 and NCDs. Over to you, Dr. Murali.
Thank you, Dr. Arora. Good day. It's a pleasure to be able to participate in the panel. So kind of delving into some points that Dr. Talukdar was kind of raising, which I think were very pertinent, is the fact that in most of Asia, the problem with us is that we really don't have electronic data collection mechanisms. First big problem. So our patients actually lie in different pockets and very paper-based data that doesn't speak to each other. First issue. Second is, and I think this is a problem which is growing more and more in Asia, that because of the fact that a lot of us are running on kind of slightly older British kind of beverage financed healthcare systems, which really have a lot of issues in terms of provision of care, there has been a lot of development of private sector. And the problem is legislation oversight has not caught up. So the private system doesn't really talk to the government system. And I think this is even in a kind of upper middle income country like Malaysia, we have these problems. And I'm sure these are problems common to across the region as well, to all of us. And so you get already before the COVID-19 pandemic ever struck, we've got this huge, very dysfunctional health system. Now, and I think many people have pointed this out, that the COVID is really, this pandemic has been a test for our health systems. And we failed miserably at it in terms of protecting those who are at risk. And this population is really the NCD population. Now, when you ask the question, like how good a job has government done, I would say at the start of this pandemic, at the beginning of the pandemic, and really I think most countries are mid-cycle now, everybody has gone into a very kind of, I run it, I call it a headless chicken phase, where you run around trying to swab everybody. You run this very acute communicable disease response. You cannibalize all your NCD resources, including doctors, nurses, testing, and then you push them all into kind of doing communicable disease response, contact tracing, so on and so forth. Now, after a bit, we started getting a bit of data out from Wuhan. And I think really quite a bit of data in the early months was the only data available was Chinese data. And that kind of pointed us out to the fact that one, people with chronic disease were more at risk. And two, when they did get COVID, they were having poorer outcomes. So again, then the kind of, I would say, automatic response was, now let's keep NCD people away from hospitals because we are afraid that they will get COVID. So again, this is another kind of, how to say, knee-jerk response, which left a lot of people with NCD, living with NCDs, be it from cancer to diabetes to mental health, really in the dark. And in many cases, those who haven't been diagnosed, you are actually even shutting off the avenue for them to even receive like diagnostic testing, initiation of treatment, and so on and so forth. So I would say from the beginning of the cycle till about mid-cycle, we've done very poorly, all governments, understandably so. Because of the need to kind of cannibalize everything and rush out and resolve this communicable disease epidemic. But that's really because, and I think you pointed this out, Dr. Aurora, when you started the discussion by saying, really, this is our fault because we've not been doing this well enough. We haven't built a strong, durable system, and now, as usual, NCD patients are the ones that are paying for it expensively with their lives.
Thank you very much, Dr. Murali. That was very insightful. Now that we are talking about building back better and also giving the due rights of NCD patients in the COVID environment, I would like to ask you, Dr. Murali, to continue this discussion. Yes, we have not been able to reach successes that we would like to have seen. What measures at the government level should legislatures or policy experts be taking to reduce disruptions to NCD services and to measure their effectiveness? So we've talked about the private sector, but what about legislatures and the policy experts?
Okay, so thank you very much. So just to kind of give some quick solutions. Again, we could probably spend like 5 days talking about this. But the first thing has actually been to kind of ring fence off the need to protect resources for NCDs, in the sense that even in the midst of an acute COVID-19 pandemic, I think there is value, and now we're seeing that. So as I was saying, I was commenting earlier that we've done miserably up to now, and now as we are going into mid-cycle, we're kind of figuring out that the pandemic is not going to end. Look, what do I do now to mitigate this ongoing issue? So now we're talking about ring fencing resources in terms of putting aside personnel now to restart the whole NCD management, both in terms of hospitals, both in terms of primary care services. So now we're talking about low risk centers, for example, just to give you one example. So areas in which COVID patients are not allowed to go into there. You have high risk centers where anybody who's suspected of having COVID is pushed there and treated there. But you have all these low risk areas or low risk treatment centers, and these now become the kind of reception point for you to receive and treat NCD patients. That's kind of one solution, and you need to allocate the resources appropriately for that. The second is, as I was saying, again, in many of our countries, there is a legislative gap in terms of engaging with private sector. So this is, again, I think in most countries we find, because of insurance and kind of the medical legal issues, private sector is not taking up COVID-19 management. Understandably, it's expensive, poor outcomes, no one can finance it, that kind of idea. So now is the best time for government to really engage in dialogue, to actually do kind of strategic purchasing, get into meaningful private public partnership, transfer your stable NCD patients, for example, to be managed in the private sector, put in like the resources, the legislative kind of policies to allow these processes to happen, so that your high resource driven costs in managing COVID-19 pandemic patients can be left in the government sector. Your more stable NCD patients, or perhaps your long-term NCD patients, you can then slowly move them into the private sector. But then, like I said, there's a lot of legislative efforts that need to be drawn together in order to make this happen. Second, and if I could put in a third, is this is the time to really invest in telehealth. Because I think everyone has learned a very expensive, sad lesson of being forced to embrace telehealth. Now I've got doctors suddenly having to see patients virtually when they've never had a WhatsApp kind of even ability before, and now people are doing consultations. We are doing consultations of about 700 or 800 kilometers apart. These are things that even patients were never used to, but I think the healthcare system has not been as quick to adapt as maybe the OECD countries or the US. Now that's another thing. But sad to say, even in a country like Malaysia, we don't even have a framework to actually conduct telehealth consultations. So it's actually still kind of illegal for our doctors to consult patients on virtually, or prescribe medication. So it's these kind of policies that we need to actually put in place to actually make sure we can live through this.
Yes, very important. I think from the legislature's point of view, telemedicine laws in the countries have really helped in addressing patients' needs during this pandemic. So, coming to our next panelist, Mr. Ralph, I would like to ask you about what strategies have you observed that have effectively engaged community members, including health professionals in NCD advocacy, policy making, healthcare delivery during the COVID-19 pandemic, and what further strategies should be adopted? Over to you.
Thank you very much, Dr. Monica, for that questions. Here in the Philippines, based on our experience, is that one good strategy is that you really need to have your core group, and you have to establish a good working, communication, maybe a small a chat group, maybe with your community organizers and coordinators. And I think that's a good strategy to actually hear on real time what is happening on the ground and what are the problems that have been encountered by patients and even the carers of patients with NCDs. And actually, that's one good strategy that we had in the Philippines. It's really using social media, using whatever communication means that we have, because we really had a strict quarantine lockdown at the start of the COVID-19 pandemic early this year. Second strategy is to call or engage your local health your local health officers or authorities, and establish connection also with your government authorities as well. So we are lucky in our network in the Healthy Philippines Alliance that some of our members are sitting in national committees or in different national networks as well, and we tap that and to ask our policymakers, our health authorities, if they are coming up with certain or specific guidelines, or if there are any old guidelines that they are going to kind of amend, especially with this COVID-19 pandemic. And that's another strategy. Keep in touch with your policymakers, specifically your health ministry or your health authorities locally. And then I think the third one is a very good strategy as well, is to engage the media and talk to the media. if they can actually feature the stories that you have been gathering. And I think it also kind of got the attention of policymakers about what is lacking and what are the problems that this has been sprouting because of this pandemic. And in terms of the other strategies that can be adopted is, of course, introductions, later on, introductions of new guidelines or policies that have not been, that is absent or missing. And at the same time, you really need to engage your all stakeholders as much as possible. You have to have constant monitoring and constant, engagement with all communities that you have contact with, because again, communication is very important, and you have to have a real-time situation analysis or situational about what's happening on the ground. Because with the pandemic, we saw many patients that, as mentioned by earlier speakers, that have been left out, or they have, completely they're like lost about what's going to happen to them, because suddenly the services that they were availing prior to the lockdowns were suddenly, cut or suddenly reduced, and here comes the fear of accessing healthcare facilities as well. And that's something that you also need to, at least give more information to them, that they can still access it, but in a different way and a different manner. So that's it, I think. Thank you.
Thank you very much. So I will ask the same question to our next panelist, Nupur. And so Nupur, as Ralph has mentioned, communication is very important. And when we are talking about engaging community members, you have an excellent experience in India. So we would like to hear from you. What strategies have you observed that have effectively engaged the community members? Over to you.
Thank you, Dr. Arora, and it's a pleasure to be here today among the esteemed panel. I want to begin saying that as a person living with NCDs, I live with type 1 diabetes. We often forget the impact of NCDs on mental health, and now during COVID times more than ever, there's a great need for us to acknowledge that as a whole community of people living with NCDs, we aren't doing much about mental health. So this is something that led us to create India's first diabetes psychosocial helpline, and we created this on an app. It's called the Blue Circle Diabetes app that's available on iOS and Play Store. And this is an entirely community-led initiative. So we've got a set of 12 volunteers, and these 12 volunteers speak 9 different languages, and we reach out to people in all corners of the country. So we have people from the metro cities calling in. We have people from, I recently had a call from someone in interior of Bihar. So this is a very small place that they were calling from, and it's incredible to be able to connect with so many people outside of the circle that we are usually used to connecting. So I think first, we've tried and acknowledged that mental health is important, and we've let people know that it's okay not to feel okay, and they can approach their community, because there are many barriers to reaching out to healthcare professionals. And that's my second point. I think technology, even Dr. Murli was mentioning that telemedicine is something that hasn't been explored as much in Asian countries, and that there's a big gap here in India as well. I think that we cannot aim to plug the gaps of the whole public health system, but we've realized now that that there is a lot that can be done. So maybe in cities we have the facility of telehealth, and we are able to connect with our doctors and healthcare providers over the internet. But this facility is not available, in the rural areas. So that's a huge challenge, and there's a whole stark I think there's a digital divide, if I could say so, and that makes it very very difficult for people living with NCDs to not just be connected to the community, but also reach out to their healthcare professionals, because they're living with something that requires medical assistance, and if they can't go to the healthcare center, then they need some sort of support. So that was my second point, and my final point here is that for community leaders, I think this is the perfect time, and even what part of what we do at my organization, the Blue Circle Diabetes Foundation, while we also work with the Healthy India Alliance, is that we're what we're trying to do is amplify voices of people living with NCDs. So there's a global youth meet which is planned for 2021, and the theme is youth lead the way towards NCD targets and sustainable development goals. We've had to rework the way we look at things, and maybe all our meetings are now virtual, but I think the great thing is that we're still on track in terms of making a noise, talking about things that matter, and getting people together. So eventually the goal is to basically in a larger public health context, to for each country and each state to be able to meet their SDGs, and to talk about universal health coverage, because that's something that's been pending for a long time. Thank you.
Thanks, Nupur. Very, very helpful experiences from the field. I will now request Ralph to come in, and if you can share with us as some of you are working as alliances and supported by NCDA's Civil Society Solidarity Fund on NCDs. So, how are you supporting and advocating for the meaningful involvement of people living with NCDs in the COVID-19 response? Because we have been hearing about patient voices. Everybody does say that, yes, it is very important to hear patients' perspectives. However, the meaningful engagement means actually bringing them to the decision-making table. So, what are you doing as Alliance in your country, utilizing the Solidarity Fund on NCDs and COVID-19 grant? Over to you.
Yeah, thank you very much. On our part, in the Philippines, we have been actually, after a series of quick consultation, online consultation that we had with the Healthy Philippines Alliance, we came up with a position paper. And the position paper is actually a combination of all the concerns, all the challenges encountered by people living with NCDs and even those who support them. And with this position paper, we kind of enumerated what are the specific policy recommendation that we have, and we passed it to our respective, to the Ministry of Health, to all our key legislators in Congress and in the Senate, because we have a bicameral setup in the Philippines. So we engage the Committee on Health of both chambers of Congress, and we kind of gave them this this document. The document is really an outline of all our what we see should be given resources. And in the past few months, they have been active. In fairness to our legislators, they have been legislating and coming up with policy in terms of who will be getting these kinds of assistance, what are the other gaps in terms of in the health system. Of course, there are many challenges in reaching out to the policymakers, to the lawmakers specifically, because they have so many sectors to actually to take care of. But the basic one, of course, here, and it actually helped a lot, is the studies that came out that people living with NCDs are at a higher risk of this COVID-19 virus and its complications. And I think that's something that gave a good perspective to many of the policymakers, that with these kinds of studies that is being documented abroad and being shared to our Ministry of Health, it also gave them like a good, a considerate eye on our proposals. And we also, aside from it, we also documented, and currently ongoing, we're actually coming up with a video documentation of the stories of our people living with NCDs, and what are their challenges, and what they think should have been done and should be done in order to improve their situation and their condition. So I think these are the most significant things that we are doing as of the moment, and it's still ongoing. And there are, we admit, it's really difficult to move if you have everyone is required to stay at home, and everything is done online, and communication is done, virtually. So it's really something that we are trying to overcome by really being persistent and being creative.
Thank you, Ralph, for sharing that. I will now come back to Dr. Murali. From your perspective, what constitutes an acceptable minimum level of care for NCDs?
Now, I was saying I fall back on the kind of Hippocratic idea of first doing no harm. So as much as we need to provide care during the pandemic, I think the idea is to make sure that we're not exposing NCD patients to increased risk. That's one. And at the same time, we need to ensure that there is no significant kind of impairment of outcomes, both on an individual level and on a systemic level. So for example, I give you the example of cancer in terms of time. I think throughout the world, we're projecting that a lot more people are going to be diagnosed later. And when they're diagnosed later, and this is true of Malaysia as well as I think most of Asia, the more that they are diagnosed later, the poorer their survival is actually going to be. And this is, I think, very much true of a lot of other NCDs as well. Now, in terms of people already living with the disease, I think the more we try to kind of delay their treatment or, have issues with delivering their treatment, all this is going to continue actually having very detrimental effects over many, many years. So the idea is the acceptable minimal level of care really should be first, risk protect, as in really keep them away from the risk of contracting COVID, but at the same time be able to deliver services at an acceptable level that will not cause any degradation to their outcomes.
Very important, because this is what I had been also looking for, whether there is a clear guideline for how NCD patients, those who are having comorbidities, how they need to protect themselves. Because there are, yes, physical distancing, masking, and other measures for general population. But whether any country has given a set of guidelines, particularly for NCD patients, and whether they know that they are at risk.
Right.
Okay, so we started with Dr. Talukdar, and my last question for today is again for Dr. Talukdar. So how do we ensure NCD care is part of emergency preparedness and available to people living with NCDs during a future pandemic? This is not going to be the last pandemic. We may have this situation later. So what is the guidance for any such similar situation in the future? Over to you.
Yeah, I got your question, and I think that this is an emergency perspective. We need to consider in a national level activities as well as the regional and global level activities. Because, if I give an example from Bangladesh, like we have a separate ministries called emergency and disaster management ministries. They are responsible for managing any emergencies like cyclone or earthquake or any other issues whenever it is come up. But still now, fortunately in Bangladesh, the ministers of emergency and disaster management, he is a medical doctor. But I talk with him, and he does not have any, legislative power to act during this emergency for providing the healthcare services at the root level. We have an infrastructure like community-based committee, community-based clubs and other civil societies who supposed to respond during any emergency period. So I think that maybe NCD Alliance can take an initiative to document the structure of different countries, how emergency time different institution or ministries can act. So there is a question about how the coordination between Ministry of Health and Emergency and Disaster Management ministries to respond to this COVID-19. So we need to understand the local context and to make a structure, and there is a need of policy advocacy to ensure this type of healthcare service during this pandemic-like situation in as we are facing during this COVID-19. But my understanding is that NCD still now is not prioritized in the health sector too during this COVID-19. When you look at that, our health policies, when you look at our drugs policies, we don't find that there is a very clear, a description how Ministry of Health will respond during this type of emergency period. There is some point, but that point does not cover the situation we have faced during this COVID-19. I'm just giving you one example. Like we saw during this COVID-19, lots of people died due to the myocardial infarction or heart-related emergency cases, as they did not get the services or they did not admitted in the hospital due to they did not have the COVID-19 test. So whenever emergency people had a heart attack, they went to the hospital, and hospital management said that until you don't have the COVID-19 test, we cannot admit you. This is the very unfortunate situation. So I think that we need to identify our priority. We need to do the advocacy and ensure the services during the emergency as well as the emergency cases during this pandemic situation. Health system need to prepare, health system need to identify that how they will provide this type of emergency services related to the non-communicable disease. I hope that NCD Alliance has taken this initiative. We are together, we are united now. We should do the advocacy that not only the Ministry of Health as well as the Emergency and Disaster Ministry should also consider NCD as a responsibility for them to provide the services for the people in different developing countries. Thank you, Monica.
Thank you. This has been a very excellent interaction with all the experts here, as well as hearing the country level experiences. We do realize in our part of the region, we all are facing very similar challenges. So some of our solutions are also going to be common. So just to sum up what we have heard from our excellent panelists today, NGOs, particularly those NCD alliances that are active in the country and the region, have a very important role. We all unanimously feel NCDs have long been neglected, and this pandemic has only underscored that our health system needs to be strengthened. And this cannot be done overnight. It does require work, and we all have realized how difficult it is to get health system to act and react to such public health emergencies. Also, we have highlighted and discussed that NGOs can help to amplify the voices of people living with NCDs and talk about their rights to the policymakers, bring it to the highest authorities, and NGOs have a role there to be able to say that yes, NCD patients need to be protected so that they are not worse affected by such pandemic in the future. We do need effective disease registry systems. We need data to be able to effectively discuss and design countering programs and policies. We do need to harness private sector, but in a transparent and accountable manner. NGOs can play an important role in advocating for NCDs as part of COVID-19 response for their countries. And that's what we have heard in many countries through community mobilization and communication playing an important part. Telemedicine and technology provide an excellent opportunity. This is an excellent window of opportunity, not only to be able to provide health services, but also to be able to provide counseling, guidance, as we heard from our speaker from India. And this also helps in advocating for interventions on NCDs in emergency preparedness plans and efforts around universal health coverage. We should look at opportunities where we can integrate NCDs and universal health coverage, because more and more people who cannot afford private health care in our part of the region do need universal health care, and that should apply to population across board. I would also like to highlight what we have heard. We need enabling policies. We cannot have a health system where it's only treatment oriented. We need to start thinking about prevention, treatment, and management to be able to ensure that we do not lose more lives to non-communicable diseases and COVID-19 pandemic. With this, I would like to thank all our panelists today. I would like to thank NCD Alliance for organizing this excellent interaction, and also ACC, American College of Cardiology, for giving this platform to all of us working in NCD prevention and control. Thank you all.